Nursing interventions in HIE. In today's video talk, we will finally discuss nursing interventions in HIE. In my past articles and videos, I have talked in general about nursing interventions, but today I'm going to give this topic more attention from a medical legal standpoint. For many parents, an HIE or hypoxic ischemic encephalopathy diagnosis can bring unforeseen challenges. With one of the biggest concerns that we hear from families dealing with an HIE diagnosis is how will their child meet the challenges this condition creates not only today in the short term, but also into the future. If you are at the start of this journey, know that there are professionals that you can talk with to get a better understanding of what may have happened during labor and delivery, which led to an HIE diagnosis. As one parent told me, I had no idea that there were people who worked in this area of law from a legal standpoint. So, what is HIE and what can cause it? HIE is a medical condition that in its basic breakdown deals with a reduced level of blood and oxygen, which can lead to a brain injury. Doctors and nurses can use a device called the electronic fetal heart monitor to get an idea as to how well a baby is tolerating a vaginal delivery. When doctors and nurses fail to properly interpret the readings on the monitor, problems for the baby can arise, especially if correct treatment options are not performed or are not performed in a timely manner. One of the ways a baby can have blood and oxygen related problems during labor and delivery and set up a possible HIE diagnosis is through constriction or compression of the umbilical cord. The umbilical cord is responsible for helping a baby get blood and oxygen delivered to the brain. Remember, HIE is a condition that is created through blood and oxygen or perfusion problems. So, nursing interventions in HIE, what are they? Nursing interventions in HIE are an important concept when investigating a traumatic brain injury at birth for a family. Nursing interventions for intrauterine resuscitation can go a long way in helping when there seems to be problems during a vaginal delivery. However, when conservative measures are not enough, doctors and nurses must be ready to move to other treatment options, like an emergency C-section when it is warranted. One nursing intervention or method that can be used during this time is to turn mother on her side or a side lying position. This is done to help shift the weight of the uterus and allows for improved uteroplacental blood flow. In addition to turning mom, the use of an O2 mask is another way which improved oxygen flow can be delivered to the baby. For some mothers, oxytocin will be used during labor using an IV. Because this medication is used for contractions, discontinued use can help decrease uterine contractions, thus improving uteroplacental blood flow. Another nursing intervention for intrauterine resuscitation includes providing mom with an IV bolus. This is done to correct problems with maternal hypotension. The interventions that we just discussed can be classified as conservative treatment measures. If these measures fail to bring about changes in the baby's fetal heart reading status, doctors must be ready to move to other measures that can help the baby. Remember, failure to act can lead to a further spiral down into serious blood and oxygen related problems for the baby. If you have more questions, about these issues for your baby, there is a telephone number on the screen right now for you to call. Go ahead and call us, as we talk with families like yours all the time about traumatic brain injuries at birth like HIE, and we would be happy to talk with you. One more thing, we practice law here in the state of Maryland. If you contact us and you are not in Maryland, please know that we must use co-counsel or local counsel, which we will provide in your state to help with the case. This is Boston Law Group LLC, and we will talk with you next time.